I'm Amanda Hankins, and I'm a family nurse practitioner, and I am very excited to be working at Aspire. Okay, so I have been working in the medical field for over 17 years. I originally grew up in a very small town in Nevada, and my first encounter with a healthcare provider was a nurse practitioner. So I knew right away that was where I wanted to be. I have been married for 17 years. I have two beautiful children, a boy who's 14 and a girl who will be 12 in a few days. And I originally started out my nursing career in Reno, Nevada, and then after graduating and getting married, my husband was transferred here. So I started out on a medical floor, and then I moved here and I worked in high-risk pregnancy and NICU at the University of Utah Hospital. And I moved to Intermountain Home Care, where I was a case manager for oncology and pediatric patients, and I did a lot of chemo in the home and tube feeds. And then I wanted to be with my kids, so I followed them to school, and I was their school nurse for 7 years. Yeah. And then after graduating MP school, I worked for a New View Counseling, where I was their prescriber, and I also work currently at Westminster as student health. So I didn't do the family nurse practitioner program, but even in family practice, mental health is about probably a large portion of your patients. And even working at Westminster, I do all student health care, but it is a lot of mental health. And I lost a good friend to suicide in high school, and so I've always just been extremely passionate about it. And I'm a very big extrovert. I love people. I'm extremely friendly. I think that's what makes me successful in my career. I've worked with a lot of patients on the spectrum disorder, and I've been known to kind of bring out a little bit of personality. And so my hobbies aren't so extrovert. I'm a good knitter. I love to read, and I do mountain bike. I love to mountain bike with my husband and my children and my dogs. But I like to be around other people and talk, and yeah. I've dealt with a lot of just basic anxiety, depression. I have ADHD. I worked a lot with transgender adolescents, the LGBTQI population, especially with Westminster. There was a large population there, which I really enjoy helping and treating and working with. And I've also dealt with some bipolar and personality disorders. And so, I enjoy treating all ages. I have a very, from treating NICU babies to the elderly. I do really enjoy adolescents. That's probably where my passion is, but I enjoy treating everybody. I am a huge believer in collaboration between a prescriber and a therapist, because as a prescriber, I would see people once a month or even less than that. And then with therapists, they see them sometimes weekly, twice a week. And so you've got two professionals working together, and I just think that is so amazing just for one patient. And then when you are successful and you can come together, and I love that. And here, I just loved how it's growing, and I know it's moving to the Draper area, and that's originally where I'm at. And so I'm just excited about helping everyone grow, and I'm excited to work with other nurse practitioners, especially those in the psychiatric field, who can help, educate me more, and I can learn a lot from them.